of that, their complaint should be not based on their orientation. This is also a component of the sexual and reproductive rights. If the
Absolutely.
patients of LGBT is also coming to, in your OPD, so they should getting a treatment of the similar thing what other people are getting, without their background, without their religion, without their socioeconomic status, without their orientation. So this is, I think it should be also included in the sexual and reproductive rights. So, Dr. Mee, what's the status of Ireland and most of the European country regarding this same-sex relationship?
So in Ireland it's great in the sense that same-sex couples are allowed to they're allowed to get married. We passed a referendum a couple of years back to actually support that. We have a very inclusive or moving towards a more inclusive society. But I think that we need to remain cognizant that this is not something we need to take for granted, because every day we do see even attacks here, towards people like this. And sometimes it can also be even just comments by healthcare workers where they are making little comments where it comes across as microaggressions. So it's what you rightly say, we don't have true sexual justice unless it includes everyone, regardless of their gender identity or sexual orientation. And this, those in the LGBTQ plus community, they need to get, undiscriminated services from us gynecologists as well. And even in countries like in Ireland and Europe, where I think the perception is that we're more open and more inclusive, I think that's not something we can take for granted, because at any point, these are all the rights that people can challenge. And that's why I think it's really important that, for example, my healthcare system, the HSE, the Health Service Executive in Ireland, we have a campaign to educate our fellow healthcare workers, hospital workers, about LGBTQ plus, what are their needs and priorities and how to address them, including, using affirming languages, what are the impacts of hormones, surgeries, and just being respectful as well towards them during their interaction in the hospital, so they feel that they're truly welcome in a hospital setting, that they can come to us for any problems. So that's something that I think we need to constantly uphold, because it's not something everyone is as used to, and I think that's why it needs continuous awareness to make sure that this right is constantly upheld.
Absolutely, absolutely, Rakami, fully agree with you, and definitely there is a view. Now, there's a problem is that now, because when we are talking about the country to country, or when we are talking about from, continent to continent, the situation is absolutely varying. Whether it's a Europe, whether it's a, Asia, whether it's a Southeast Asia, whether it's a Middle East, it is actually varying. For example, though I am not going to go in that politics, but few days ago, the Afghanistan, the foreign minister came to India, and they have, when they are going to have a press release, so they don't want any female journalists to be present there. So actually, this is a variation from them, from country to country. So this is really very, I think, a very, very tough job when we are talking about, when we are talking about sexual rights, it's also about the contraceptive. Because, see the fertility rate of Afghanistan, see the fertility rate of other, Middle East country, and it's really had a very bad impact of the female. They are suffering from anemia. There is a lot of, maternal mortality, maternal morbidities are there, and criminal abortions are there. All the problems related to the abortions are there. So I think it is very tough. When we are talking about the probability is easier in a countries like Ireland or some European country, but it is a difficulty when we are talking about some Asian countries or some African or South African countries. So it is really difficult. So according to you, how we can actually, make this difference? How we can make up this difference?
Maybe just to give an idea of my background. So although I am training and practicing in Ireland, I was born and brought up in Malaysia, so we also have a very similar culture as opposed to India and to, you know, the rest of the Asian countries. And I think that and to give context in Ireland, Ireland is a very Catholic country, and that has informed a lot of how it's practiced and the policies for many, many years. In fact, it wasn't until 2018, after many years of groups and individuals advocating for it, that we finally have abortion in Ireland. When I first started working in Ireland, there was definitely the atmosphere. I happened to start work in one of the it's known as the most Catholic region in Ireland, and I was told like never even to provide information, not even talk about abortion with the patients because it's a criminal thing. That's the why among the people there. And I was a young doctor, you know, just after med school, that sort of way. So I think that the thing is, every country, like you rightly say, they have different cultural, different religious attitudes towards topics like contraception, abortion. Even now, when I'm talking to people about sexual pleasure as well, that all really shapes the access. But I think that the way to navigate that, and that's something I think we need to really do more. I don't think it's confrontation. It's not saying that what you're doing is wrong. Obviously, we have that idea, but it's also when you approach people in that way, when you're saying what you're doing is wrong, they are going to be, you know, they will be turned off from actually discussing further with you. So it's a more collaborative kind of approach that I think we need to take. We need to understand, why do you think it's wrong? You know, is there some misunderstanding that has happened there? Is there something within your religious text that we can work together with? Is there, you know, it's about respecting each other within, you know, our cultural frameworks in order to actually promote the evidence-based care, create those, if let's say we identify that within this religion, within this culture, there is this concern. How do we find the evidence that makes it comfortable, make it safe for this group to actually then accept that this is something that is safe for their population, that it gives choice, it gives dignity, rather than something that's focused on morality. You know, we're not really kind of arguing this is right or wrong, but it's just working together side by side, how we can bring this care safer to the population that we're working with. Because I think if we're looking at the core of it, they both, you know, different factions, whichever sides that you're on, I think at the end of it, you care for the people, the patient, but the way that we work towards it, it's different. So how do we make sure those people are actually getting the care? You know, they need to be at the core of what we do. You know, not about fighting the different ways to do it. I think that would be my thoughts these days about this.
No, absolutely, it's correct. When you are talking about absolutely, let's be discussed. And what I think now, it is more on the religion part. That's the reason they are you know, just not taking the contraceptive or not doing you know, the abortions and all. It is more to the religion part than to the, because you know, see, everybody wants, you know, everybody knows. I think to create the awareness is really very important. You know, even many times when I am from a very small place, and the tribal populations are coming here. So even they don't know about, there is something known as contraception. There is something, some methods which is there, which we can have a difference between our two babies. So this is really very important to give an awareness, because people don't know about their own rights. Even they don't know, even they know that their rights, but they don't know how to implicate it and what are the different methods are there. So this is, I think, a very important, and when we are talking about to give and create abortion, you know, awareness is really, really very important. So this is very important thing. Now, one more thing, Dr. Mee, I just want to ask from you, because you see, in our country, when we are talking about a lot of, I have had a podcast with some Asian kind of the person from Asia, AOFOC person, the FIGO person, and now from you as a talk. And they all is emphasis of one thing, that is the sexuality education. And unfortunately, probably India is among the first in the world which give the rights of abortion to our own people. And now we have, like in 1970s, we have implicated with that laws. We have the contraceptive. It's a government programs where we give information to the contraception and all. So, but unfortunately, even we are lacking behind this one thing, that is the sexuality education. So I just want to ask from you, is really so important to give our youngsters to the high schools and to the college students about the sexuality education? So what your views?
I think we probably share the same views, I'm sure. As we start at the beginning, we talk about that sexual and reproductive rights isn't just about like, having sex, about preventing people from getting pregnant, that sort of things, and sexual pleasure. It's more than just that. It's sexuality education. It's not just anatomy. It's teaching respect, consent, boundaries, empathy, all of the part of a healthy sexual and reproductive well-being. And we see that countries that implement sexuality education, like you rightly say, because they have the awareness, the education, we see a lower rates of teen pregnancy, STIs, sexual violence, because this was embedded in from young. And just like with anything else, like we learn to write, and even these days, people learn to type, at a young age. So why not education about respecting ourselves, respecting people, about consent, about setting boundaries? Why shouldn't it start early? Absolutely, I think that as soon as, they have the understanding, so about like what, 5 years old, 4 or 5 years old, it needs to obviously, because just like different society, different culture, religion, you need to structure things according to how they will understand it. We need to do that at an age appropriate level as well. So I think it needs to start from, body autonomy, giving them the ownership, and then it evolves with their maturity in their thoughts to include things like contraception, consent, healthy relationships. And I think that the earlier we start, the stronger the foundation for them to be responsible. We're not giving this education for them to, we're trying to get them to prevent, teenage pregnancy, that's the things. It is essentially, but you want them to make an informed choice. That's the whole idea at the core of it. It's to be able to make a choice that you at that time with the no
lot of resistance from the parents, from the society, because they are thinking the sexuality education is about how to do sex. It's not like that. The horizon is beyond it. And definitely the countries like us where we have a lots of teenage pregnancies are there, lots of criminal abortions are there, there's a lots of STDs are there. So I think it is need of the hour that every country should implicate this in their basic syllabus, so that we teach our kids, we teach who's tomorrow who will be the adult one, that what is this is the things, and probably they will engage into the unsafe sex, which is can lead to the STDs, the HIVs, and also the other things. So this will definitely prevent it. So I think the horizon of the sexuality education is much more what actually we are thinking, and definitely the impact is also very high when we are applying the sexuality educations. So Dr. Lee, you are also seated with VETOG. You were the office bearer of VETOG previously, and you're representative from Europe to VETOG as a representative of VETOGs. So, what basically VETOGs is doing, I just want, because many, the youngsters, young gynecologists, they are thinking, we are just now, we just passed it out, and what's our role in all these things? But what you thinking that what's a young gynecologist can do, and what's the VEDOC say is doing for the women health?
So I think that thanks for yes, bringing up WATOC. So within WATOC, it is a young society, especially compared to like societies like Fogsi. It is very much so WATOC collaborates a lot with FIGO. And within FIGO, the contraceptive sexual reproductive health, that is one of the committee that's part of it, and that they work on all these different issues about sexual rights, access, and that there's even a women's facing crisis group, so facing kind of like unsafe abortions, and even about like contraceptions for like access for example, marginalized groups, immigrants, sex workers, groups like this. So in terms of what WATOC can do is that we provide the opportunity for young doctors or trainees, specialists to actually be part of this conversation. We would have like at the recent FIGO conference, we had a WATOC session that is specific to contraceptives and sexual reproductive health. And within it, what we were discussing, for example, my topic was contraception for female sex workers. And my other colleagues from other countries was on talking about like contraception in preventing gynecological cancer, and then about unsafe abortion, as well as about female genital mutilation. And I think that's like what you rightly say, it's about creating the awareness, creating the education as well. And not just for the public, but also clinicians, because as clinicians, even when we are what we call young or early in our training, we are basically the people who have that encounter that one shot with that patient to educate them and to dismantle some of the myths and misunderstanding that they have about certain concepts. So, and one of those things that I think we need to talk more about, in fact, even now bringing the Young Sexual Medicine Academy into it, which is the young chapter of the European Society of Sexual Medicine, is talking about sexual medicine. Because I think the other stuff, we do remember to talk about them, but not so much about sexual function and dysfunction. And it needs to be as normal as it is discussing about blood pressure, for example. So in terms of what people can then do, I think that we need to just look about where we are right now in that setting, that interaction with that patient, is that you can already start by educating yourself, and also that education, that one-to-one. And that's why I am very grateful for your invitation to join this. Although I've never done a podcast before, I was like, I told myself this is something I must do, because I see it that you have given me the platform, and that's what I would advise everyone else. If you've been given a platform, with your patient, maybe with a patient group, with your society. Accept it, challenge yourself, accept it, because that is our duty as a doctor to actually educate others, educating ourselves along the way as well, engaging in discussions like this, and also then being able to contribute and advocate for our patients. Talk to your patients, find out why they are, resistant to this, what their thoughts are, because that's the population we are servicing. We're trying to make sure they get access to our contraception, safe abortion, fertility care, inclusive care for all the different genders and sexualities. So that's what I think I always start with. I think that sometimes it can be very daunting to think that, oh, how can I join these different societies and things like that. I think without going into it too much, sometimes, so a lot of societies would have like a young chapter. There will be, have a platform for us to be part of it. But I'm sure you have to experience yourself. There is sometimes a little bit of a political thing involved with it as well. And so sometimes maybe as a young clinician, you feel that, oh, I'm too young, I don't have enough power for that. But no, I don't think that's the case. For example, my training is 8 years. That is many, many years of training as a doctor, of the interaction with patients. We can work within what we have, within our own community, educating our patients and our peers, our friends around us, so that they have the information and be able to advocate. I think that's what we all need to do. There's now increasingly more people who are speaking up on social media as well. One of my colleague, Sarah Murphy here in Ireland, she would start like a social media on Instagram, and I have seen so much of the work that she's put in, and that has really kind of come back to patients being just more informed about pregnancies, about different gynecological conditions. And I think a lot of the times as well, the other thing is that, and no one likes complaints, but I think we need to change the way we approach complaints. Like sometimes when patients come in, because now they know the information, they know how to advocate for themselves. And a lot of it now, they have the right information, which is great. And then they challenge the doctor, why can't you provide this and that? I love those kind of interaction. I have to admit, I find it quite scary and quite daunting. But now I see that because, the patient's now able to advocate for themselves, therefore, it works way more powerful if they could then, put the pressure on the government, on the Ministry of Health, on the hospital to provide better care for them. And that all starts from, from them having that education. That all starts from the doctors to ensure that they have the right education. So we are all in this together to try to improve care. So we need to include our patients. So by to reframe what I just said, that was like, if we open our mind to all these complaints and take it as a way of feedback, as a way of actually them advocating for themselves, and therefore if we are listening to them, that also creates a better service. That's really all we need to do, really, rather than closing our mind off. And that's what I think we can do as individuals at any level.
Absolutely, absolutely. It's wonderful. So it was a wonderful discussion about the reproductive and sexual rights, and definitely we share the exchange from yours, from British point of view, from European point of view, and from Asian point of view. So it was a wonderful discussion. And after that, because we have some time left, so why not, Dr. Mee, we will go into the core sexual medicine part. Okay,
The what?
like the core sexual medicine part, can we discuss some sexual dysfunction which you are getting in your day-to-day life? Okay, okay.
So,
So yeah, so
yeah, I
yeah,
suppose
yeah. Please go ahead.
within sexual functions, we will talk about, arousal, desire, pain, genital pelvic pain, and orgasm. And while we have started the conversation, or we have a little bit of education about sexual pain, even things about vaginismus, and with with menopause health, we talk about desire. It's very little that we talk about within the components of it. And if we talk about it among clinicians, generally we would only think about what's the biological problems with it. When we look at a patient, examine them, we are only looking at like the biological parts. Is there any parts that is wrong? But the way that sexual medicine is that it's also it's not just acknowledging the biological part, but also the psycho, social, relational kind of factors to it. And that's something that's missing in a lot of our history taking. I fully acknowledge that it is I don't know how it is in India, but I think that you also have the challenge with your patient consultation time. You simply can't do this sometimes over one visit or even over 15 minutes. And
Absolutely.
that's always the challenge, because you're trying to provide this care to more people, but the quality of this, because some of these questions, it requires rapport with the patient to build the rapport, and that simply can't build over a short time or even one visit. And that's the thing in our focus that we don't focus enough about. That sometimes even things like pain, it's not just about like biological part, it's also about the other things, what has caused them. I think patients are now kind of more open to share if there's been any other sexual trauma about like, their relationship with their partner. But it still takes some time to get that out of them as well and to explore. And it also requires the doctor to be open-minded to how different people have sex. For example, we think, and that's in our society, we think about monogamous sex, we think about like heterosexual sex, but there's also many variants of it. So it's to open our mind. And when we open our mind, I think that we give the vibe to the patients that we're open to hearing without any judgment. And that's the most important thing. So within sexual medicine, what we're trying to address is this concept as part of the implicit concept. But the first thing there is you give permission. So by doing this, you're giving the patient permission to actually share this with you. And it's only by knowing their problems, by them sharing, that we are even begin to solve what are the problems that's part of it. And then there's the other things about like understanding what is the normal sexual response like. I think a lot of the time we think that, oh yeah, just stimulate, it goes up, the curve, orgasm, that's it. I think that's what we understand. That's from like social media, from like books, what we understood, and also, but we know that when people have sexual problems, it works differently. So and these are concepts that have been going around for many years now, but it's just not, we just didn't have the awareness among clinicians, among gynecologists. It's not in our medical school studies, not in our training to even understand how a sexual response is, what are the different things that can affect it. And only now we're beginning to even think about like how menopause, how endometriosis is affecting like things like pain and desire. One thing that we don't think about enough, I think, is also what happens after having a baby. We all think that, oh, well, like if you've had no problem getting this, getting pregnant, that means that you have, after you can come back for your second, third, fourth, fifth baby. But within the work that we do, there's also, people who suffer birth trauma, and we don't talk enough about that, how that affects, and parenting. Parenting can be a bit traumatic, affects the relationship, a healthy relationship, and we don't have that service. Even within Ireland, not every there's only one hospital that, as far as I know, that would have a public psychosexual counselor. So there's not enough investment in this service. You can have access to private psychosexual counselors. It costs about 50 euros per session. And as we've just talked about, it's not just one session that you need. Sometimes it's more more sessions that you need. And that's just the psychosexual part of it. When we're talking about like access to like medication, so one thing I have faced is that and now there's more emphasis about like, starting on people on vaginal estrogen, which is great. But there are also other medications where some people have vestibulodynia, and they may need medication that has the testosterone component. My colleagues in the USA have access to compounded pharmacies where they can make those medications that the clinicians want. I don't have that access here in Ireland, and that does restrict my wife's practice. There is, like, for example, a medication called Intrarosa or prosterone that converts into both estrogen and testosterone. However, accessing that medication is not easy. It is not cheap. It is about 60, 70 euros per month, and you need that for 3 months. And it's not like I can import this medication from other European countries because it would be illegal, So that there's all these different frameworks that I think us as gynecologists, we can actually write to, for example, for me, I've been trying to get in touch with the company that produces, because they can then submit a request to have that included as part of the national drug payment scheme, so that it's more accessible to patients. Not the best, it's not going to be free, but we're definitely making ways. For example, even when it comes to contraception, it is now free contraception that's being provided from the age of 17 to 35. Why it's not provided for people after 35, I don't completely know that. But I mean, previously it was up to 25 years, so at least now they have increased it. So I believe these things, just like when we come to limited resource like money, I know that it needs to be in stages, but it's also up to us as doctors. We are seeing the patients on the ground. We're able to inform policymakers, the politicians, what our patients need, what we need. Because yes, we do see ourselves as doctors. That is an added role, but we are also patients. You and I both have our sexual and reproductive rights as well. So we are also advocating for ourselves, when it comes to this. Sorry, I think I kind of brought like a whole kind of train trip around this. I could go on talking about this forever.
Yeah, absolutely. So, Dr. Mee, what you have told now, it's a very practical thing. And probably even we have in our mind that Europes are so much developed, probably these problems will not be faced by doctors or patients from that side. But I think it's the same, whether it's a Asian country, whether it's a South Asian country, and whether it's a European country. And whatever problems you are saying, it is the same, almost the same which we are facing about the psychosexual counselor, about this problems about the medicine and etc. So absolutely, it's very true. And I think this is the best part of this podcast is it's a two-way. See, even in a lecture you are just just seeing the PPTs and describing the fact. But in the podcast, we are actually having our own ideas and our own experiences and our own talks. So that's the things I think it's better for this poster. And that's why Dr. Sunita Madam, our Fogsi president, have started this initiative and with some topic, a particular topic for a particular day. So I think we have discussed a lot of things, and thank you so much. And probably this is really very fruitful to our all the viewers about the sexual rights, the reproductive rights, the LGBTs, etc. So thank you so much, Dr. Mee, for giving your precious time. And definitely in future also, we will come with some very interesting and very beautiful topic, and we will discuss, and definitely it will be beneficial to our viewers. So thank you so much. And once again, I will really thankful to our very dynamic president, Dr. Sunita Tandulwadkar, madam, for this wonderful podcast series, the Gyan Pravah, which is really a wonderful initiative, and it's give a tremendous exposure not only to the viewers but also we doctors also, because we are not used to of this podcast. So thank you so much, and thank you so much to the technical team and for providing us the technical part. So thank you so much. Thank you so much, Dr. Mee. And definitely I also welcome you in India for our upcoming conferences. If at all possible, please do, and you will get the vibrant Foxy what we are. So thank you so much. Thank you so much. Thank you so
I
much.
want to say thank you very much as well again. Like it really is meaningful that Dr. Sunita thought about this and for you for reaching out to me. And also I know we've had some kind of scheduling issues, so I really appreciate how you can accommodate me as well in order to give me the platform to actually share my views. Like you say, with podcasts, this is where we share our opinions and things. So I'm very grateful and thank you for including me as part of it. And I do hope to meet you at our many international meetings, perhaps also in India as well. I'm definitely due a visit back to India. I was there in 2018. It was, and I told myself I have to go back. So why not for a
Oh,
conference,
wow.
right?
Thank you. Thank you so much.
Thank
Thank you
you.
so much. Thank you so much. Thank you.
Take care.
Okay. Okay.